Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that myself, I am MD in Ayurvedic medicine, that is Kaya Chikitsa subject, and MD in Ayurvedic physiology, that is Kriya Sharir subject. Also, everybody is now knowing that Dr. Deshpande has running a series of the different videos regarding the Ayurveda in general medical practice or Ayurveda in GP. This is the name of the series. And this series is very interesting because a lot of responses they come from the different students and the doctors, and they are commenting that, sir, this is very good because we are understanding what Ayurvedic medicines can be prescribed and what type of investigations we can do with these particular problems. My dear friends, today's video may be little bit lengthwise longer because we have to discuss all the problems in one set, that is regarding the psychological problems. As you know that our human being is like a coin. On the one side it is a physical body, and on the other side it's a psychological aspect. And when there is a well coordination, well balance in between the body and mind, then the person can remain healthy. If you go for the Ayurvedic definition of the healthy person, the first line of the swastha vyakti, healthy person, as mentioned by Sushruta, samadoshaha samagnischa samadhatu malakriya prasanna atma indriya manaha swastha itya vidyate. So Ayurveda has also given the importance to the physical fitness as well as the mental fitness. Ayurveda, it is called as a sattva, and sattva sarata examination is most important in Ayurveda because Ayurveda says there is a different what you can say the factors which can affect your physical disease process. For example, Ayurveda has said Vishado Roga Vardhananam. That means Vishad, tension, anxiety, this can be the basic cause for not getting as per expectation results when we treat the patient. That means whenever there is a physical entity like arthritis, hypertension, cardiac problem, diabetes, and this and that, and we are trying our level best to treat the patient, but sometime or the other way, the patient's mind is not that much cooperative to the responses to the somatic level. That's why in our general medical practice, 70% people, patient, I can personally say that they are psychosomatic cases. What do you mean by psychosomatic? Soma is a physical cells, and the psycho is a mind. So mind is affecting on the physical body, and physical body problems, they affect the mind also. I will give one simple example. For example, if the person is having a chronic type of the psoriasis or chronic type of the rheumatoid arthritis problems, then day by day he gets frustrated and he thinks, what is in my life? Because I have to take the medicines for throughout the life and there is no complete cure for my disease. So this particular feeling is getting what you can the drill his mind, and the mind is becoming little bit what you can say the on the negative side. So positivity and negativity of our mind is very much essential to get cure or to get not cure or not getting enough results from the treatment. So even there are some stories that although the person is suffering from very difficult problems like cancer, still the if the patient's what you can say the mind is very strong, then he can definitely take over or come back for that particular cancer like diseases also. Now, without wasting our much discussion, I will like to focus on these four important psychiatric problems. The first problem is neurosis, second is a depression, third is a hysteria, and fourth is a schizophrenia. One thing I would like to tell you, there are the three important causes of any disease in Ayurveda. These causes are asatmya indriyartha sanyoga, second is a pradnyaparad, which is related with the mind, and third is a parinam, that is the kala factor or the time factor, which is very less in our hand. But asatmya indriyartha sanyoga, our faulty contact of sense organs with the objects, like if I am not taking care of my eyes and I have the lot of screen time is more, then my eyes and accordingly my physical body will suffer. Okay, so sensory organs and their objects, the correlation is not balancing. This is asatmya indriyartha sanyog. Indriya, of course, the sensory and motor organs both. Pradnya parad, pradnya is the intelligence. What is the definition of Prajnaparad in Ayurveda? Dhi, Dhruti, Smruti, Vibhrashtaha, Yat Kurute Ashubham, Prajnaparadam Samvidyat, Sarva Dosha Prakopanam. So Prajnaparad, intelligence not having the enough capacity of decision, that is Dhi, not enough capacity to follow that inner consciousness, that is Dhairya or the courage, and Smruti, not remembering the positivity and negative effects of our past deeds, that is a memory problem. So Dhi, Dhruti, Smruti, Vibhrashtaha, Yat Kurute Ashubham, Prajnaparadam Tam Vedyat, Sarvadosha Prakopanam. Then we have the Sattva, Raja, and Tama, three gunas. Sattva is always balanced state of the mind, quiet state of the mind, tranquility of the mind. But Raja and Tama, Raja is overexcitement and Tama is a little bit on the opposite side. That is a negativity. For example, here you can see the neurosis and depression can be considered as a Tama problem, and hysteria can be considered as a Rajo Adhikya in our mind, hyperactive state of our mind. So let us talk about the neurosis. Neurosis is like a fear. Many patients, when they get a chest pain, they immediately think that, oh my God, I am at the heart problem. So there may be heart attack, so I will die. So this type of unnecessary feeling, for example, getting pain in the left part of the chest is most of the time muscular pain. Actually, the heart pain should occur middle, that is retrosternal. But because the common man, they know that the heart is on the left side. So the patient directly comes to your doctor, doctor, see, I am a severe pain in the chest, so I am getting the heart attack. So this is called as a cardiac neurosis problem. Okay, so this type of neurosis of the different fear for the different diseases is always present. So that is a neurosis. So what are the types of the neurosis? Anxiety neurosis, phobia is a fear, obsessive compulsive neurosis. That is called as a, these are the very common problem. The many people, they are, for example, if I am leaving my house and I am making a lock to my door, so this peculiar person, they are always having a fear that I have not locked properly, and so they do the things again and again, just checking that whether I have done that locking properly or not. Similarly with the hands washing, that some people, they have make addicted to repeated hand wash because in the fear in the mind that because of the non-sterilization, unhygienic condition, I may get serious infections like corona or other diseases. So they are always in a tense and fearful manner. So this is called as obsessive compulsive disorders. So OCD patients are always very common, and in all the psychological problems, the most important thing that Ayurvedic doctor is advised is a counseling. That means explaining what is happening with your body and mind. The second thing, the proper correction in the diet, because sattvic diet is always beneficial for the psychological problems. And lastly, we always advise for the medicines or the treatment, but there also shodhana and shamana. If there is a lot of ama in the body, toxins in the body, we do the detox of the body by different panchakarma. Even we adopt general body massage, shirodhara, or the nasya treatment for the brain. All these managements can be taken place in addition to these particular medicines. Okay. So hysteria, that is a convulsion neurosis, then dissociation neurosis, and depressive neurosis. These are the different types of neurosis. Now, what can be the causative factors? So I will mark for you, and so that it is easy for your understanding purpose. Okay. So biological factors like, for example, heredity, family, then the constitution, vata pradhan, pitta pradhan, kapha pradhan, or rajasic constitution, mental constitution. Endocrine disturbances may be the factor. Metabolic causes and biochemical abnormalities are not considered as a significant causes because these are the secondary problems. Environmental factors are more important. For example, in the age group childhood, adolescence, and involution are the periods more susceptible for this particular tension period. Personality, person with the anxious, inadequate, and obsessive personalities are more susceptible. Frustration in sexual aim is considered as some of the important but not authentic evidence is available for this particular cause. Then precipitation, that means attack can start, Vegavastha can occur with some physical, psychological, or physiological stress of a moderate to severe degree. Factors like difficult family situation, occupational and financial difficulties, and heavy responsibilities without adequate family support, social support, economical support. Prolonged or debilitating physical illnesses like influenza commonly precede the onset. That means some viral infection takes place and then these attacks always exaggerated. So what is the treatment? Let us see the treatment part for the anxiety neurosis, how we can treat these patients. Okay. So always keep in mind that neurosis is like a benign tumor. It's just imaginary labeling. And psychosis is like the cancer of the mind. So naturally, neurosis can very well be treated. And psychosis will need the treatment from psychiatrist or sometimes electric shock like treatment or admitting in the hospitals, etc. This is needed in the psychosis, not in the neurosis. Neurosis patient needs time and sympathy is more important. Psychosis patient may need electric shock or insulin shock as a therapy. For the neurosis patient, make them talk. Let them talk. Give the assurance. Train them how to tackle with the problems. That is the stress management. Following treatment can be advised in addition to the support you or boost up the conscious or the moral. This is a Suvarna Makshikadi Vati, 1 tablet 3 times in a day, especially this patient, if the patient having the weakness or the anemic condition. Then Brahmi Vati, specifically acting on the brain, 2 tablet 3 times in a day with Saraswata Arishta, 4 teaspoons with equal amount of water 2 times in a day. Now the depression, this is another disease where the patient is not interested even in the day-to-day activities. He lost interest in the life. He like to be make himself alone and he don't want anybody to interact with him. And this particular depression, if going on the very severity, then these patients can make suicide at any time. So be careful while talking or dealing with the depression. Even you inform to the family members that always look towards this patient sympathetically, give them support. Always somebody should be with him and he should not be kept alone for a longer time. Okay. So what are the etiological factors? It is actually not clearly understood. Not only single factor is responsible. Too many things are coming together. For example, hereditary, incidence of depression, then cyclothymic temperament and suicide is high in the family of patient suffering from basically illnesses. Exact mode of transmission is not known. Constitution and physics. So especially the connect body weight is more commonly associated with manic depressive psychosis, whereas involutional depression is more often seen in asthenic persons. So these are the different terminologies of the psychiatric, what you can say, the books. Temperament, this is cyclothymic temperament, that is swings of mood, sometimes very feeling very energetic and sometimes feeling something like a depressed condition, is more often observed in the patient diagnosed as a manic and depressive psychosis. Manic, depressive psychosis. Manic is a exacerbation of the enjoyment and depression is a low, what you can say, the mood. Then personality is melancholic, anxious and obsessional personalities are more predisposed to this illness. Season, incidence of depression is reported to be high in summer month. Okay. But let me clear you this fact. I personally believe that in spite of the India, it is okay. But in the foreign countries, whenever there is a lot of darkness outside, this depression or anxiety always exaggerated. So there are some even suicidal tendencies are more common where the sunlight is less. Okay. So we have this point is a little bit debatable point. But personally, my experiences is telling, as I have visited already many years for the foreign countries for Ayurveda propagation, I am sure about it that gloomy and dark environment always gives you the depression. Then age, onset of the illness is usually after 25 to 30 years, peak at the age of 40 to 60 years, though there are reports of children suffering from this illness is also existing. Now, little bit about the gender, male and female, both can be affected, though there is a variation as far as the depression is concerned. Precipitation, history of stressful environmental factors immediately preceding the onset of illness, usually available in all types of depression, but more often in the reactive type than the autogenous type. stress in any form, physical stress, psychological stress, then physiological stress acting on susceptible or predisposed persons can cause the depression. So what we can treat, as I have said, Ashwasana Chikitsa is most important, counseling is most important. Rule out the cause of depression and try to get the solution, not by only doctor, but from the relatives, by the society, by his family members. Let us see what can be better done. Then next tablet is Ashwagandha Vati. This is a spelling mistake. 2 tablets 3 times in a day. Saraswatarishta 4 teaspoons with equal amount of water 2 times in a day. Some patients who do not respond to the treatment may need, that is ETC, that is electric shock therapy. For this matter, you have to consult with the psychological or psychiatric doctors. Then Ayurved Seva Sangha, Nashik, they have the Mematone tablet, 2 tablets 3 times in a day. Or Charak company has also made a very good tablet, that is Becamine, 2 tablets 3 times in a day. Now we will talk about the hysteria. Hysteria is generally, it is very well known that it gives the convulsions, and it is mimicking. That means the doctor or the patient's relatives, they get confused whether it is epilepsy or whether it is a hysteria. In Ayurveda, for the epilepsy, the word is apasmara. In the hysteria, Ayurveda word is unmad, hysterical attacks. The most common difference is that epilepsy can occur at any time in the day, but hysterical attacks never occurs at night. Number one, because they are related with the mind. It's not related with the physical level problem or physiological level problem. It is related only and only with the mind. So these particular convulsions, these fits are occur in front of the people because they want to show off that how I am suffering, how my condition is very bad, etc., etc., to the public, to the society. So it is all related with the mind. So these fits, these convulsions will never come at night. Number one, they come mostly in front of the people. These patients, when they get fall down, they will not hurt for themselves. They take that much precaution. Epileptic fits can occur even at night. When it occurs, it can harm to the patient. Then in the hysterical attacks, there will not be tongue bite. Epilepsy, it can happen because it is all physio. This is a psychological problem. This is mental problem. Are you getting? So this, by looking these particular features, differences in epilepsy and hysteria, you can easily diagnose that these convulsions are because of the mind and these convulsions are because of the brain problem really. Okay, so let us see. Age, the peak incidence is in between 20 to 30 years. Children and old people also show a high incidence of this hysterical problem. Sex, gender incidence is more common in the women than the men. This is very interesting to note this particular point because maybe trouble from the mother-in-law and what you can say, the house or the father's, husband's house, where the lot of relatives are not treating this particular new married woman, and then this particular fits or convulsions can take place. Intelligence, people with low intelligence more often suffer from hysteria. Personality, commonest in the hysterical personality. Characteristic for dramatizing and exhibiting. Attention seeking. She wants that everybody should take care of me. Immature in the thought process, shallow and superficial emotional relationship. Marital status, hysteria is reported to be more common in unmarried, widow, and divorcee. Socio-cultural factors, hysteria is reported to be more common in primitive, developing, and less sophisticated or less cultured societies. Then causes of hysteria coming further, pet parents, child relationship may be little bit not proper, history of unhappy childhood, abnormal parent-child relationship, broken home or unsatisfactory relationship between the parent is more frequent in patients suffering from hysteria. Healthy personalities develop hysterical symptoms under conditions of severe stress or when the resistance power is lower down after prolonged physical illness or maybe head injury. So what we can do? Treatment. with the help of the relatives. We must take the help of family members. We must take the help of the even society members like his friends and this particular group of the people. Try to find out the root cause for the sufferings, why the particular patient is having some psychological trauma. Then plan out to sort it out, because this is the main thing. Only tablets are not good for these particular cases. More often in acute phase of hysteria, patient may try to kill themselves. Advise relatives to have the proper watch on the patient and do not pamper them unnecessarily. Just what you can say, just observe, but don't give too much importance to that person's demand. In case of acute attack, get rid of the entire crowd except next to the keen relatives. Confidence of a doctor is the need of time. That means if that hysterical patient, in front of the hysterical patient, if doctor is not confident, then there is a problem. So sniff, that means giving sniffing with the vacha churna or onion or smelling salt if necessary. Read out a single instruction about the medicine as patient feels better. Give the very careful advice. I'm not saying that that means follow all the demands for him, or all the whatever he wants you give. Not like that, but feel the patient that yes, doctor is very serious about your illness and he will take the proper care. So the patient will be little bit more satisfied. The tablet Siledin from Allersin company, 2 tablets 3 times in a day. Ayurved Rasashala Pune has a fantastic liquid and also tablet Prosham, 4 teaspoons with equal amount of water 2 times in a day. Then Manasa Mitravati Aryavedya Shala Kottakal, 2 tablets 3 times in a day. As a preventive, Pratimarsha Nasya of Vacha oil every night 1 to 2 drops. Then Brahmi Prasha 2 teaspoons each morning with the milk. Next problem is a schizophrenia. Schizophrenia is a little bit serious complaint. Group of mental illness characterized by specific psychological symptoms leading to disorganization of personality of an individual. The symptoms chiefly interfere with the patient's thinking process, emotions, and behavior in a characteristic way. So what can be the causes for that particular schizophrenia is little bit more serious than the anxiety or the depression. Actually, the cause is not exactly known. Probably maybe several factors are there. Hereditary transmission is probably through 1 or 2 autosomal father or mother from that generation genes. The disease may carry forward. Personality, schizoid personality, that is individuals who are social but shy, reserved, eccentric, oversensitive, fond of books and nature, and having very few friends. Their body structure is asthenic type. Childhood development and parent-child relationship. These are some other causes for the schizophrenia. Broken homes, divorce, overprotection or rejection by the parents, precipitation, predisposed individuals under any condition of stress, physical, psychological, like infective diseases, pregnancy, childbirth, or psychological problems. Endocrine problems may be there. Biochemistry like liver function test, renal function test you have to do. Metabolic disturbances incriminated but not 100% proven cause. Now treatment. What we can do for the schizophrenia patients. Try to understand the root cause of the problem. Help the relatives. Helping from the relative is very important. Then plan the way out of the situation with trained help of psychotherapist. Assure the patient. Ashwasana Chikitsa in Ayurveda. Do not hesitate to send patient to the psychiatrist or special doctors. And Abhraka Basma Ayurveda Seva Sangha Nashik, 100 to 300 milligram 3 times in a day, can try to rejuvenate the damaged cells of the brain. So my dear friends, in today's long lecture, I can say Dr. Deshpande has discussed the psychiatric problems in GP, how the some symptoms are there and what the doctor can do with these particular problems. We have discussed neurosis, depression, hysteria, and schizophrenia. So my dear friends, please don't forget to subscribe my YouTube channel and give the boost for my genuine efforts to share my knowledge and experience. Thank you very much. I wish all the best. Take care and see you in the next video. Thank you.